Growing up, my father bought a place in the Vail area back in the late 60s, and we've been coming up to the Vail Valley since then. Married for 45 years to Susan, and this home that we're in right now we bought 20 years ago, and we bought it because of the family. We wanted a place for the family to come, to be together. As much as we love San Diego, this is just, when we come here, we really feel like we're coming home. My eldest son, Shane, actually, we lost him 2 years ago. It turned out that the root cause of it was alcoholism, and he was a drinker in excess, really quietly, because he was otherwise a very successful attorney. Shane died when he was 37, but I think what Shane struggled with was he felt that he could conquer alcohol, so he didn't want people to know. And he was afraid of that stigma. He was afraid of that, having that reputation that he was a drinker, not only with his friends and professional associates, but also with his family. Shane is not unusual, I mean, in the sense that to deny that there's a problem is, not only can you deny it as an individual, but I think we tend to deny it as a society. I don't think there's any question that largely my attraction coming back to the Valley as a young person especially, and even later in life, was the party scene. And have a really hard day skiing, then let's have a real good hard day drinking after that, too. It's not complete without that. That's not the case, I think. As time has gone on, of course, and I've realized the hard way what's important in life. And I think the challenge has been in the past, there's not been a person to talk to, there's not been a facility to recover from, there has not been an awareness in general that this is a problem that manifests itself in tragedy many, many times. I've gotten so much from the Valley, I would like to give back to the community. We chose Eagle Valley Behavioral Health. It just seemed like a perfect fit, frankly. I just was so fortunate to be introduced to somebody that was already engaged as a donor and somebody that was experienced in terms of recovering. I want to make a difference, and whether it's with one person, one family, or otherwise. I want alcoholism to be a conversation that people are comfortable having, and I think we can make a difference. I think the EVBH is making a difference. I think we've got a certain level of momentum now. There's a certain awareness out there. I think we need to reach out and use our resources to make the health situation as beautiful as the scenery. That should be the challenge. Can you come in here as a permanent resident, as a part-time person, as a visitor, and leave it better than when you found it?